around our country. And I'm here today because of Mary, because she couldn't be here. And I know all of you are here for millions of others who couldn't be here themselves. And we're standing up for those people and fighting for the change that they need. Now, change has never come easy when it comes to health care. We know that. We only have to look about half a century back to see that when our country tried to pass Medicare, it was an epic battle. But we did it. And it took a lot of time and a lot of struggle. But as a result, millions of Americans over the age of 65 are getting the health care that they need. And that's because people stood up to fight for Medicare. That there's no way that we cannot pass health care this year. And I'm confident that we will do that. Thank you so much.
It's Betty McGuire. She is a security officer here in the downtown office. So please welcome her, Betty McGuire.
Good morning, everyone. Good morning. First of all, I'd like to say this is not part of my speech. I must say it first, though. I read a sign somewhere that said, Jesus heals people with pre-existing conditions. This lets me know that we have to have a system that supports everyone. Now, this is part of my speech. Thank you. My name is Betty McGuire, and I live in the Dorchester area of Boston. I worked as a security officer for almost 6 years. And for almost 5 of those 6 years, I didn't have any health care insurance. My husband was sick on disability, but he had insurance, but I had none. I realized when I went into security that I was working for a company or companies that have low pay and a high rate of turnover. So of course they aren't going to offer us decent health insurance. But I know what decent health insurance was like because I worked 28 years for a company that gave us decent health insurance. I know that most of my years for working at the security offered me no insurance. And they tell us we have health coverage. We have coverage that you need. It's just a scam. So if you're working for security, don't believe me, it's a scam. Yeah, now, some of the health insurance companies in security field say they have an affordable plan. Do you know that plan? $10,000 deductible. Can you believe it? $10,000 deductible. Who can afford that? Who can afford that? Well, they're pulling our legs. We can't afford that. But what we need is a plan, an affordable plan for everyone. So we're here today to ask our senators, to ask our representatives and all those that care that we need that plan. We don't need it 10 years from now. We don't need it 5 years from now. We need it now.
Let me introduce a member of SEIU 1199. She is a nurse, and this is Debbie Howland.
Hello, my name is Debbie Howland. I'm a public health nurse for the city of Boston. I've been a nurse working for the city for 29 years, mainly to low-income people. I go to people's homes and I see how people struggle with not only healthcare costs, but their rent, their heat cost, and many other things. People have to decide sometimes whether they're going to pay high premiums for the little healthcare they have, health insurance, or whether they're going to pay the heat.
We can see your greedy side. You can't hide. We can see your greedy side. Hey, how you doing, Mike? Good to see you.
They're all taking pictures. Hi, how are you? So anyway, yeah, I shook you